One of the things that's getting much more attention, though, in this OCD, anxiety, depression world is the role of inflammation. What is the best a way to approach eliminating OCD behaviors in my autistic daughter? She's 20, has been having these behaviors in the last year. Behaviors are escalating, becoming more ritualistic. I try to intervene and redirect her. Um, I'm not going to read this whole thing because she gave some examples. She can get very frustrated if we try to block what she's doing. This is just one of the. Okay. She does get ABA therapy at school, but this does not seem to help the behaviors. There was a time I'm not gonna go. Okay, just talked about a couple of those CDs. Okay, well, first of all, in an individual such as this, I would wonder to know if anything happened around the time that these OCDs. Did they take antibiotics, any medications, anything, change in diet, anything that may have potentially exacerbated this situation? Okay, now in my practice, when I see a patient who presents this way, I'm doing two things at the first appointment. Number one, I talk about treatments that have the potential to lower, because OCDs run in the same circles as anxiety and depression, kind of on that serotonin, dopamine area. And so I'm looking at things that kind of can help bring that under control. I talk about L-theanine, which is an amino acid made from green tea that bumps the serotonin and the dopamine levels. It also blocks glutamate, which irritates the brain. That can sometimes be helpful. Sometimes I'll add 5-HTP, which is 5-hydroxytryptophan, which is the precursor to serotonin. So I kind of look at the theanine as the construction worker, and then the bricks are the 5-HTP, and that can potentially help. I'll also start looking especially at the non-THC cannabinoids, starting off with the CBD, potentially bringing in the CBG, CBGA, etc., like that. That's kind of like how my first fishing net when it comes to treatments. But then for me, it really comes down to our typical biomedical workup, the gut brain connection. How are the levels of the good bacteria, flora that's supposed to be there? Are there any pathogens like yeast, bacteria, parasites that shouldn't be there? Okay. And we do stool testing, we do urine testing to look for that. We look at things like vitamin D levels. We know importance of vitamin D needs in order for serotonin to hit the receptor and to get it to work. Vitamin D needs to be there, and that's why people who get seasonal depression in the wintertime, because they're not getting vitamin D from the sun unless they're taking it as a supplement. So, vitamin D levels, my old standby is looking at zinc and iron levels because I want to check that on everybody. Looking at the good health. Sometimes there could be mitochondrial issues. And so, coming back to our CoQ10 and our carnitine levels, that could be helpful. Then I also want to look at their B vitamin metabolism and coming back to the methylation pathways that we were talking about before, the MTHFRs, the MTRs, CBSs, all of these tell us much more about B vitamin metabolism. And that's certainly one of the places where I start. Now, one of the things that's getting much more attention, though, in this OCD, anxiety, depression world is the role of inflammation. Okay. So taking a look at more of like what, maybe there are some neuroprotective, neuroinflammatory things like protective bioflavonoids that could be helpful. Um, could there be any heavy metals there? So it's, not too dissimilar to the workup that I would do for a person with autism, anyways. But my treatments may be a little different. If I'm working with a kid with autism or an adult with autism whose primary issue is communication, I have other therapies that I would potentially be using for that. But that's really the kind of the way that I would approach it. But you also did mention ABA, but you didn't mention any other type of therapy. And there are like cognitive behavioral therapy. That is a particular form that it needs to be done by a very, very well trained mental health therapist, that can be very helpful just in terms of it's a kind of like a deprogramming type of thing. And I think that that could be helpful. One of the things that, and I'm going to get more into this as time goes on and more research comes on, but I'm very, very fascinated at people who are at where the role of psychedelics are going to come. You probably have started to hear about people using small doses of psilocybin, and other types of and people taking it one time, doing intensive therapies, and it's helping people with PTSD and anxiety and depression, mostly pharmaceutical resistant forms. And so again, with OCD, I would be interested to see if we start seeing stuff coming out with that. Now, this is obviously very not ready for prime time. You cannot get them legally anywhere, I believe, except for Colorado. There may be another place where it's illegally done. Certainly not available here in Florida, but do kind of keep your ear open for this, because I think that we are going to see in the next decade, hopefully sooner, a lot more research coming out. It is coming out fast. And so, and will I do believe that a pharmaceutical company will take the active ingredient and proprietize it and encapsulate it and to make it into a standardized dose, which is great. I've actually seen some smaller startup companies. There's actually a company that I was just hearing about called Small Pharma. They chose that name to kind of combat big pharma. So I thought that was kind of cool that they were giving a little dig right there. But that's actually in the process of starting to go through phase 1 trials. I think they actually are in phase 1 and are developing phase 2 now. So be on the lookout for that, because I think that could be something very interesting coming up. We are all about health, education, and choice. Please share this with others who are of the same